Hi and welcome to the Resources Roadhouse. I'm Wally Graham. I'm at the South-West Connect ASX Showcase where I caught up, well, I thought we'd take a bit of a different tack. You know, normally we talk to the resources companies, but this time I just spied this medicinal cannabis company and it just sort of struck my interest, and not for any particular reason. So we spoke to their Chief Executive Officer, Jo Patterson. Jo, welcome to the Resources Roadhouse.
Thank you very much.
All right, so this is a little bit interesting for the Roadhouse and for myself personally, because, all right, so I normally do the resources, but seeing you here, I'm interested. We've got medicinal cannabis, I believe. So medicinal cannabis. Okay, so what is, why, who, what, where, and why?
Sure. Big market. It's kind of hard to sort of summarise it, but in terms of Australia, the way it grew is really from an agricultural play, and so, you know, there's lots of growers in Australia. Our area of focus is very much on the clinical trials and the drug development, so we're at a different end of the supply chain. And yeah, our sort of purpose is all around creating medicines and also using CBD for healthcare. I was just going to say there's just enormous amount of research, scientific literature in terms of what it supports, and I think you'll find that there's much greater acceptance, and I find that each and every day when I speak to someone, they're always telling me a personal story about, you know, my mother-in-law, my father-in-law, and it's really great because there's certain specific indications that, you know, CBD is understood to have benefits. And of course there's more work to be done in clinical trials, but, you know, people are getting significant relief for things like chronic pain. Insomnia is another really big one. We're running a clinical trial in Australia on insomnia, and that's for a Schedule 3 product, which means that you'll be able to buy it through the pharmacy without a doctor prescription. So we're really excited about that.
All right, and you're right about the anecdotal thing. I mean, I hear about it too. People say, "Oh, I've been taking this cannabis, you know, solution, blah da da,"
Absolutely.
and people, you know, some people swear by it. You know?
Absolutely.
Yeah, so that's really good. So, whereabouts are you based?
So we're based in Sydney, but we've got research programs running in the UK as well as in Australia, and we work with some of the best research partners here in Australia, which is really exciting. We sell product in Australia through what they call the SASB market, so a doctor prescription can prescribe it. But we sell in other parts of the world like the US and the UK where it's permissible. So it is complex in terms of the regulatory landscape, but we have distribution partners that sell in other markets as well.
It's becoming quite a competitive space, isn't it?
It's competitive at the agricultural end, I would say. I think that's the sort of the commodity space. So I think in our area we seem to have a lot of clear air in terms of what we're doing, and we've been consistent around that focus of clinical trials, and the last 5 years we've really been investing in that space, and at the moment I think we're at a really interesting pivotal point where we're going to look at commercialising some of those assets. So today we announced an international patent that we've just lodged, and more recently we did an acquisition on a drug delivery technology which has been in the making for 5 years.
Yeah.
So really great stuff. I'm really excited to bring it to market.
All right. Well, it sounds like it sounds like a very, very interesting company that you're working up, and that you. Well, yeah, an interesting, what would you call it? You wouldn't call it a commodity even, you'd call it, you know, a science.
Well, I just think these medicines are really important, and they're being used by patients or consumers where they haven't been able to, you know, their particular condition, they haven't had satisfaction from an existing registered medicine, and they're getting real benefit. And some of the stories are pretty incredible, particularly around chronic pain, where, you know, that has really had a massive impact on their lifestyle, and you know, and the relief that they've been getting from cannabis has been amazing.
Oh, Jo, well, thank you very much for your time.
Thank you.
You know,
Thanks
we
a
learned
lot.
a lot, so
nice
good
to
luck.
talk to you today. Thanks.